There are so many different philosophies and ideas in America. I don't think any plan that comes out will be acceptable to one part of the population or another to a very significant degree. And it's jealousy. When somebody has something that you can't have, it bothers you. So I would like to suggest that there be one benefit plan for every American in this system, and then people who want to people who want to have other benefits besides that, they can do something like the Medicare supplemental insurance plans. So I'd like to ask your opinion on that.
Both Senator, well, I shouldn't say, I should never speak for Senator Baucus, but I feel in this area that maybe I can say that he and I are working towards something that is going to give Americans more choice than what your suggestion would be. Now, will we be able to, we're working and talking, and I don't know if there'll be a product or not, but we're working towards the direction of having people to have choice.
Thank you, Senator Grassley. My question is about Medicare, and you're working with Max Backus on financing this universal health care plan. There's 40 million seniors on Medicare. There's 80 million more coming. We know we have to increase funding to take care of that. The seniors are smart. They're maybe old, but they're smart. They know we have to increase funding for Medicare. We cannot let this be taken away, this $500 billion, the $160 billion for the Medicare Advantage program that's going to be taken away. We'll leave 10 billion seniors in a world of hurt. Seniors, I work with seniors every day, and I ask them what question they would want for you, and the one thing they want to know is, how can you possibly be talking about cutting funding for Medicare right now? Possibly, how can you even consider cutting Medicare funding right now?
Where we're going to be dealing with the long-term cost of Medicare is directly dealing with the way medicine is practiced in Iowa and other states of the Midwest, because if the entire country practiced medicine the way we do here, Medicare would spend 1/3 less money. So take 1/3 of $400 billion, and you come up with a lot of money, and if you can do those things, we're going to be able to extend Medicare a long period of time so seniors and baby boomers will have less to worry about.
Hi, Senator Grassley. Thank you so much for giving us this opportunity. I've been a critical care nurse for over 30 years, and I'd like for you to tell us the proposed bill that's being presented, if it's passed, what benefits will that bring to the citizens of Iowa? I would hope that we could all, continue to be respectful of each other and courteous, so that we can have some minimal dialogue. Thank you.
For one thing, making sure that reimbursement that we almost have to work on every year is not cut, because the formulas we have in place, particularly for doctors, but there's other healthcare providers as well, that would be very harmful if they went through. Now, we've always, I think out of the last 10 years that formula has been in place, we've done it all except for a 6-month period of time to keep those formulas going so that reimbursement would come back. In one of the bills that we passed in 2003, the Medicare Modernization Act, we did get a lot more money, about $25 billion for the 28 states under the national average, because you couldn't take money away from the high states, which you probably should have done, but you couldn't get it done. So we added money in, and Iowa got $579 million of that pot of money, the second highest of any state. Now, another thing we need to do is, within the delivery of medicine, we need to get more primary care physicians. We need to make greater use of nurse practitioners, physicians, assistants. We need to get an ethic within medicine that nurses can do a heck of a lot to deliver health care that they never get credit for delivering.
Senator, I have a statement first. I believe that the nationalized medicine is actually another tax. I have a question for you. The question is, do you know of another nationalized healthcare program anywhere in the world that works? We know that California doesn't. We know that Massachusetts doesn't. We know that Britain doesn't. So there's a yes or a no question there. The next one is quite simply, do you know a government industry that is run more efficiently and saves more money than private industry? And the last thing, is, if this is so good for us, the American people, why has Congress excluded themselves and their family from this program?
The answer to your first question is no, but I'd like to go a little bit further if you'd let me. And I always argued I shouldn't give long speeches, but the reason they work at all is because you get rationing, and I'm not for rationing of health care. And if I could speak to the people who don't think I ought to be sitting down talking to Democrats at all, or 3 Republicans and 3 Democrats talking, I would like to say that there's 2 things that the Republican caucus asked me, well, 3 things, asked me to make sure that 2 we don't do and 1 we do. And 1 was to make sure that we don't have any rationing. Number 2, to make sure that we don't have any government-run plan. And number 3, to make sure that we have medical malpractice tort reform. And on the other issue, first of all, because your question was about Congress being included in a government plan. Okay, first of all, I'm against a government plan.
Sorry.
But if we do have a government plan, Congress should be included. Congress should be included. Okay, but he asked if we did have one, should Congress be included, and they should be included.